What's up guys, Josh from Strength Side. Today we're going over what anterior pelvic tilt is and how to fix your anterior pelvic tilt. So when it comes to anterior pelvic tilt, I think one of the most important things is understanding what's going on in your body. Once you understand it, it's a lot easier to fix. So at the end of the video today, you're gonna have a better understanding of what's going on in your body. You're gonna have 2 excellent exercises that you can use to help correct your anterior pelvic tilt. Let's get to it. So let us first understand what anterior pelvic tilt exactly is. So anterior pelvic tilt is really just a motion of your pelvis when the pelvis moves anteriorly, which means to the front, and it's basically when this happens. The pelvis tips forward. So all anterior pelvic tilt is just a motion of the pelvis, right? We also have posterior pelvic tilt, and that's when the pelvis moves back and kind of does this more tucking under motion. So sometimes when people say, I have anterior pelvic tilt, you know, it's not like having the flu, right? It's not a disease. It's actually just a motion that you do with your pelvis. That's like saying like, I have hip flexion, right? What they probably mean is that they have trouble getting out of anterior pelvic tilt and their body tends to pattern to anterior pelvic tilt. So what really needs to go on in your body to create more of a neutral spine and pelvis position is we need some forces to go on, right? So if we really squeeze the glutes and get good hip extension here, then that's gonna push our pelvis kind of forward and help lock it in place. But if we don't get enough core tension here, then we're just gonna do this, right? So we're gonna push this forward, but the spine is still extended here, right? So what we need is we need these kind of 2 opposing forces to go on for the hips to come forward and then the core muscles to kind of push back. So we're kind of doing this, right? And that makes a very strong aligned structure here, right? So we need some hip extension from the glutes and we need some core activity from the abs and a lot of these other core muscles to then create, boom, a locked in spine. That's how we're gonna fix it today. So the first exercise we're gonna start with is a tucked hollow hold on the back. So all you're gonna do is you're gonna lift the knees, just place them right over the hips here, and then we're going to flatten that lower back down to the ground, okay? That's what's very important here, is that we keep this locked in position. And now from here, what we're gonna do is we're just gonna reach the arms straight up, okay? So really reach through the arms here, right? Don't sag down, press the shoulders forward, that's gonna protract your scapula, and then if you want, you can touch your knees or you can keep a little space there, but just make sure to keep some tension in the legs as well. And we're just gonna hold this position. This is called the tucked hollow body hold. If you point your toes, that's gonna help create more tension here as well. And you should really just feel all your core muscles start to engage, work, and fatigue as you hold this position, right? If your neck starts to bother you, you can place your head down. But I like to keep the neck up, especially in the beginning, because that helps create more tension here in the stomach, okay? So the tucked hollow hold. Start with trying to hold that for 20 seconds, see if you can work your way up to a minute. Now, from this position, we're set to do a dead bug, okay? But we want to keep that same hollowed out position here, and you don't want your core to move. You don't want the torso to do this as I go back. We want everything to stay in alignment here, nice and stiff, and then I come back, okay? Here, really reach through there. See if you can get that leg and the hand really low to the ground while keeping the lower back flat, and then you're back, okay? So that's the tucked hollow hold, and then the dead bug, right? Tucked hollow hold really trains the core to stay stiff, and then the dead bug helps us practice keeping stiffness here while we're moving our hips and our shoulders. Last one that we're gonna train because we just got done training the core. Now we want those glutes to be able to do their job. I like to train this one second because now the core is engaged and it's ready to stabilize as we do our glute bridge. So stiffen up the core, put the back flat to the ground just like we did in those previous 2 exercises, and then drive your hips straight up. Really squeeze your butt here, but keep the core stiff. If this happens, this is not a good position. This is not going to assist you in fixing your anterior pelvic tilt, but this is, okay? So notice, if my hips don't get super high, that's okay because I'm keeping stiffness here in my core, right? Don't sacrifice the stiffness here just to say, oh, look how high I can get. My glutes must be strong. No, you're actually just sacrificing position, okay? Stiff, we lift, boom, boom. These are not very intense, so I would suggest doing higher reps, something in the 12 to 15 range. And then what you can do as you get better at that is now we can do a single leg bridge. So I'm here, I lift a knee, I stiffen here, and now I'm training one side at a time, so it's going to be a little bit more challenging for my glutes, but they're also going to get more intensity, okay? So now, like we talked about before, we're training this front side to put force down, we're training this back side to put force forward, and we're creating this nice, strong, stable spine and pelvis that's really going to help you fix your anterior pelvic tilt. So get started on these exercises right away. And now that you understand what's going on in your body, you have the power to use these exercises to fix the issues that you have. Guys, remember to check out our free exclusive videos on fixing anterior pelvic tilt that you actually can't get on YouTube. You have to sign up to get them. And one of the things we answer in these videos is how long it takes to fix that anterior pelvic tilt. All right, guys, that's the video. Be sure to stay tuned for the next one where I'm going to go over the best stretches for anterior pelvic tilt. Now, in my opinion, this stuff we did here today, the exercises are the most important, but the stretches will also help too. So we're going to do that in the next video. Stay tuned. As always, I'll see you in the next one.